I'd like to share with you our study of tear fluid biomarker for the assessments and monitoring of retinopathy and prematurity. Infants born prematurely have incomplete vascularized retina with peripheral avascular zone. The supplemental oxygen given after birth downregulate the growth factors and cytokine, which caused the retinal vessel to stop growing. This is the phase 1 of the proposed pathological vascular changes in IOP by Lois Smith. With increased metabolism, and they become a relative hypoxia, especially in the avascular retina. This in turn upregulates the productions of VEGF and other angiogenic cytokines, leading to the phase 2 retinal neovascularizations. Method to moderate the development of IOP. During phase 1, controlling oxygen exposure will prevent the suppressions of the VEGF and the other cytokines, including erythropoietin. In phase 2, the use of laser or anti-VEGF are aimed to inhibit VEGF and therefore lead to resolutions of the retinal neovascularization and prevent the complication related to retinal detachment and blindness. We currently face a third epidemic of IOP. The incidence has increased due to the improved survival of small premature newborn among the middle-income country. Diagnosis of IOP requires repeated dilated field examination, which is quite stressful to the premature infant. This at times can lead to bradycardia, apnea, and sometimes cardiopulmonary arrest. It requires special technique and expert care. Therefore, a less invasive way to detect the occurrence of IOP and guide treatment is much needed. Human tear film are a complex fluid comprised of secretion from a number of sources, including lacrimal gland, goblet cells, cornea, and a vascular source. The tear film contains thousands of molecules, including protein, peptides, lipid, electrolytes, and small molecular metabolites. Recent advances in mass spectrometer has enabled efficient and more sensitive in-depth analysis of proteomic profile of tear fluids. There's an explosion of scientific article and editorial how tear proteomic research can revolutionize the way we managed our clinical practice. There has been a number of articles on the tear fluid level of angiogenic factor and inflammatory markers and the association with IOP. One of the recent articles have shown interesting finding of lower tear level of VEGF and increased level of angionin and other inflammatory cytokine reported to associated with the IOP development. We undertake a prospective study of tear fluid biomarker for the assessment and monitoring of retinopathy or prematurity. This is a collaboration between ourselves and the Hong Kong Polytechnic University. The hypothesis is that the tear fluid contains a variety of VEGF and cytokines. Their level at the screening of IOP are different in the premature infant who later develop IOP when compared to those without IOP. The objectives is to use the SWAP MS, the sequential window acquisitions of all theoretical mass spectrometer, to compare the difference in the level of angiogenic factors and cytokines in tear fluid of patients with IOP and those without IOP. To demonstrate the association between the level of tear fluid angiogenic factor and the cytokine and the treatment response following laser treatment and the intravitreal VEGF injections. This is an observational prospective longitudinal study. The intended study period is about 24 months, and 30 subjects will be enrolled into the study. They are divided into groups of no IOP to those of IOP. The tear sample will be collected by the Sherman strip. It will be subjected to the sequential window acquisitions of all theoretical mass spectrometer for protein analysis. The expected result is that the tear fluid VEGF and cytokine level is associated with IOP, and this could be a non-invasive tool for the IOP screening and management. Our preliminary results are showing promising. We have identified a couple of novel biomarkers The development of the non-invasive biomarker using the tear fluid proteomic will help to reduce the frequency and the stressful eye examination for this vulnerable group of infants. This potentially can provide an accurate and timely identification for those IOP premature infants who require treatment without the dependency of the highly skilled ophthalmologist. This is particularly important in locations with the limited resources. Thank you for your attention.